Hello and welcome. Today's class is going to be in cardiac murmurs in children. Cardiac murmurs are extra sounds which is heard during the heartbeat when the blood is flowing through the heart and the vessels. And murmurs are common in childhood and they are often harmless, so they do not require any further investigations or treatment. But sometimes it can be pathological where the investigations and then further diagnosis is required. So you have to learn how to differentiate between the innocent murmur and the pathological murmur. So today we are going to discuss on this. Definition for cardiac murmur will be abnormal heart sound caused by turbulent or irregular blood flow in the heart or nearby blood vessels. Heart murmurs may be present without any heart disease. The murmur can be flow murmur when the turbulence in the blood flow is at or near the valve. Then these are called flow murmurs. And there is another murmur known as shunt murmur. These are abnormal murmur which is heard through the abnormal communication within the heart, like in the VSD, septal defects. Bedside, when you auscultate, you need to describe the murmur. So when you describe the murmur, first you talk about the location, which cardiac area you're hearing the murmur. Then you have to mention the category of the murmur, whether it is systolic murmur, diastolic murmur or continuous murmur. Then the intensity of the murmur is checked, which is of grade 1 to 6. Then pitch or the character of the murmur should be seen, like rough or blowing or harsh, like that. And then the radiation of the murmur has to be mentioned. So these few points you have to remember when you are auscultating the precordium. Now come to the grading of the cardiac murmur, which was 1 to 6. So commonly used grading is by Levin's grading. This is commonly used in the clinical settings. So according to this, grade 1 murmur is a faint, very faint murmur heard only with intense concentration. So specialist is required. A cardiologist can only hear this murmur. Then grade 2 murmur is faint, but it is heard easily in all position, even by the all doctors. Then grade 3 murmur is moderately loud, but this one does not have any thrill. And grade 4 murmur is loud and it is associated with thrill. And grade 5 murmur is very loud, associated with thrill, and is audible with stethoscope partly off the chest. And grade 6 murmur is the loudest murmur, which also has a thrill and audible with stethoscope off the chest wall. So even without the stethoscope you can hear this murmur. So these are the 6 grades of murmur which you have to differentiate in your clinical bedside postings. Now come to the types of murmur which you can see in children. So one is innocent or the functional murmur, and the number 2 is pathological or the organic murmur. Let's see what innocent murmur is. This is also known as flow, benign, non-pathological, functional, inorganic or physiological murmur. This is seen in 77% of the neonates. 66% of the children may have this innocent murmur, and then it is heard in 90% of cases when the child is doing exercise or after exercise. 90% of the children may develop innocent murmur, or you can hear this innocent murmur after exercise in children, 90% cases. So what is innocent murmur? This is murmur which is occurring due to physiological turbulence of blood within normal anatomical heart. The heart structure is normal. So due to the turbulence of the blood flow, you are hearing this murmur. There is no structural cardiac defect or disease in this condition. There is no hemodynamic abnormalities. Pulse, blood pressure, all these things are normal. and then this murmur become very prominent during fever, anxiety, anemia, infections and exercise. The character of the innocent murmur, how you are going to identify. So innocent murmurs are systolic in nature, very soft, and then till grade 2 only you can hear. Then only exception is venous hum, where there is a continuous murmur. Beside this, all the innocent murmur is systolic murmur. There is no thrill. Intensity is variable. It changes with the position or posture of the child. The blood pressure pulse is normal. Second heart sound is also normal. And then if you do X-ray, ECG or echo, all these are normal. So usually we don't do, but if you do all this is all normal in this child. The example of innocent murmur in childhood is number 1, vibratory stills murmur, number 2, pulmonary flow murmur, number 3, physiological pulmonary flow murmur of neonate, number 4, carotid bruit, number 5, venous hum, and then 6, apical murmur. Pathological murmurs. So pathological murmurs are associated with the structural abnormalities of the cardiovascular system. The characteristics will be, it is systolic and diastolic both. So it may be systolic when the grade is more than 3 or louder. So if it is pathological, it should be systolic grade 3 or louder murmur. It is usually associated with thrill. It can be pansystolic or it can be diastolic in nature also. So all types of murmur can be heard. Then abnormal pulse is there, blood pressure may be abnormal, second heart sound is also abnormal. The child may have cardiac symptoms of the diseases, and the ECG, X-ray and echo is all abnormal. Then you call this murmur a pathological murmur. Examples of the pathological murmur. Let's see the systolic murmurs. Systolic murmur can be pansystolic, which is also called holosystolic. So pansystolic means throughout the systole period. S1 till S2, it is throughout the systole period you can hear the murmur. So diagram should be made like this. So first heart sound, second heart sound, again first heart sound. So within the beat, throughout the systolic phase you are hearing this murmur. Example of systolic murmur is conditions like VSD, tricuspid regurgitation, mitral regurgitation has a pansystolic or holosystolic murmur. Next systolic murmur is ejection systolic murmur, or also known as mid-systolic murmur. This is heard in the middle of the systole. So if you see in this picture, S1 and then this is S2, so in between diamond shaped murmur, this is ejection systolic murmur. This murmur is heard in conditions like innocent murmur, all the flow murmur across the semilunar valve which occurs in VSD, ASD, PDA are ejection systolic murmur. Aortic outflow obstruction like aortic stenosis, condition like pulmonary outflow obstruction like pulmonary stenosis, and coarctation of aorta. So all these have a ejection systolic murmur. Then comes late systolic murmur, which is heard in mitral valve prolapse and tricuspid valve prolapse. Diastolic murmur can be early diastolic murmur heard in aortic regurgitation or pulmonary regurgitation. So this diagram is showing aortic regurgitation murmur and pulmonary regurgitation murmur. So diastolic murmurs are beginning after the second heart sound. You can see in this figure. Then comes the mid-diastolic murmur. Examples: mitral stenosis, tricuspid stenosis, atrial myxoma, increased flow across the AV valve, atrioventricular valve. So all flow murmur across the AV valve is diastolic. All flow murmur across the semilunar valve is systolic. Then Austin Flint murmur, Carey-Coombs murmur. Then comes the late diastolic murmur. Examples: you can hear this in mitral stenosis and tricuspid stenosis. Next murmur is continuous murmur. Continuous murmur is heard throughout the systole and diastole. So starting from S1 and then ending till next S1. So throughout the systole, S1 to S2 is systole, S2 to S1 is diastole, if you see in the picture. So throughout the systole and diastole you can hear the murmur. This is a continuous murmur. So you hear this murmur in conditions like PDA, aorticopulmonary window, arteriovenous fistula and venous hum. The key takeaway message of today's class will be most murmurs in children are innocent and harmless. Murmurs with symptoms or abnormal features will be pathological, so they will need medical assessment. An innocent versus pathological murmur can be detected by history and examination. So very careful examination and history taking is very important when you are going through a child having murmur. Thank you. If you find my class helpful, please like, share and subscribe. Next class I'll discuss another cardiac disease. Thank you.